So today in this discussion, we'll look at the thoracic cage. So for me, this is a preamble to the respiratory system. So before we look at the actual organs and other structures that make up the respiratory system, I would like us to look at the thoracic cage. So thoracic cage involves bony and cartilaginous elements. So we're going to see that this cage, or the thoracic cage, if you like, is made up of bones and cartilage. In addition to that, there will be other soft tissue that is attached to these bony and cartilaginous framework. For example, intercostal muscles. Then in addition to that, we have neurovascular bundles, that is nerves and blood vessels, not forgetting lymphatics. So first things first, the rib cage, or rather the thoracic cage, is made up of the following boundaries. So first of all, the anterior boundary of the thoracic cavity is the sternum and the intercostal cartilages. So these are the costal, sorry, I said intercostal, but costal cartilage. These are the costal cartilages. So we see that ribs do not completely ossify. Of course, they begin as cartilage, but the anterior ends remain as cartilage, do not completely turn into bone. So these blue portions here are the costal cartilages. Then in the middle there is the sternum. Sternum made up of those parts, manubrium, body, and xiphoid process. Then the anterolateral and posterolateral walls, in short, just the lateral walls of the thoracic cavity, is made up of the ribs. So the ribs here are forming the lateral walls. Then posteriorly, it is a vertebral column. So this is a vertebral column from thoracic vertebrae number 1 up to thoracic vertebrae number 12. So there are 12 thoracic vertebrae at the back there forming the posterior wall, together with their intervertebral discs. So these are fibrocartilaginous junctions or joints attaching the adjacent vertebral disc. So these are made up of fibrocartilage, whereas the costal cartilage are made up of hyaline cartilage. So let's look at the two joints that we're going to find on the posterior and anterior aspect of the thoracic cage. So anteriorly, we see that the ribs connect to the sternum. Not all of them, by the way. Some of them do not make connection with the sternum. Therefore, they have no joint anteriorly to the sternum. Nevertheless, anteriorly, we're expecting two joints. So there's a joint between the rib itself and the cartilage. So that is a costal junction there. Then the costal cartilage makes a joint with the sternum there. So each rib, well, only 7 out of 12 are attached to the sternum. Then at the back, the rib is making joint with the vertebral column. Now observe that the rib is making a joint with 2 vertebral bones, one superiorly, one inferiorly, and the rib attaches there. In addition to that, the transverse processes of the vertebral bones are also attached to the rib. So there's another joint here between the rib, tubercle of the rib, and the transverse process of the vertebral bone. Then the actual joint is there between the head of the rib and the vertebral bones. Okay, so those are 2 joints that we're expecting. One at the back, that is between the rib and the vertebral bones. Another one anteriorly between the rib and this costal cartilage to the sternum there. Okay, that being said, these are the parts of the rib cage. So anteriorly, we have sternum divided into 3 parts: manubrium, body, and xiphoid process. Then ribs have different classification. One of them is here, where we have true ribs and false ribs. There's another classification looking at the features of the ribs. So this is classification based on attachment. There's also classification based on features of the ribs. Okay. Now let's look at the manubrium, the sternum and its part. So can also be called breastbone. So this is a bone in front of the chest. The midline of the chest, we find the sternum. 3 parts of the sternum, that is the manubrium, the widest and thickest part is manubrium here. Then the longest part or the middle part, we call it the body. Then the inferior surface is called xiphoid process, meaning we're going to have 2 joints. So the manubrium is attached to the body of the sternum here. So we call that as manubriosternal joint. This joint there is manubriosternal joint, otherwise known as sternal angle of Louis. So if you run your finger on the sternum, you feel a lump at this stage. Now we call it sternal angle of Louis because this is a point where the second rib is attached. So just lateral to it here, you see those depressions. Those are facets for attachment of second rib. We are here. So if you're counting ribs, rib 1 is very difficult to palpate and know, but you can feel or locate the position of rib 2 just by identifying the manubriosternal joint, because lateral to it is second rib on either sides. So that is sternal angle of Louis, or otherwise known as manubriosternal joint, in line with second rib. And there are so many structures that are found at this level. If you draw a line, horizontal line cutting through at the sternal angle of Louis, or otherwise known as manubriosternal joint, you're going to find various structures located at this level. Example given is the arc of the aorta. Another one is the same level where the trachea is bifurcating to give us a primary bronchus. It's at the same level where the descending aorta is beginning, the same level where the ascending aorta is ending. It's at the same level where the thoracic duct transitions from the right side of the chest to the left side of the chest. Okay, that is just to mention but a few. So much of the great vessels are located here. The pulmonary trunk is here. The pulmonary arteries are there. Okay, so this is an important clinical landmark because of those structures I've mentioned. Patients who have stab wound or gunshot wounds at that level, we expect damage to one of those structures or most of those structures I've mentioned. Come in. So saying these are structures located at the sternal angle of Louis, and potential damage to those structures will occur if there's injury, especially penetrating trauma at the angle of Louis. So more detailed here is the sternum again, showing us those 3 parts: manubrium, body, xiphoid process. This is the lateral view. Now we see that in the lateral aspect of the sternum, beginning all the way from the manubrium and up to the end of the body, where the body makes a connection with the xiphoid process, there are these depressions, we call them facets. So these serve as point of attachment for ribs. So you see that the superiormost facet here is attachment for the clavicle bone, or what we call the collarbone. So the collarbone attaches there. Then immediately inferior to it is rib 1. Rib 2 at the sternal angle of Louis. This will be rib 3, 4, 5, 6, 7. Therefore, only 7 ribs are attached to the sternum. Rib 1 up to rib 7 have direct attachment to the sternum. The rest, that is rib 8 to 12, have no direct attachment to the sternum. Then if you observe on the manubrium, there's this notch here. It's also known as the insular or jugular notch. So that is a jugular notch on the sternum there. Okay. Quite distinct. If you palpate on yourself, you can still feel that depression on the superior aspect of the manubrium. Now, the xiphoid process mainly remains cartilage until late in adulthood. I want to show you something. The earlier skeleton here, you can see that it's still blue here. It is still hyaline cartilage. So until around 25th year of life, slightly above that or maybe below that, this xiphoid process is completely turned into bone and fuses with the body of the sternum. Same with the sternal angle of Louis. That joint there is completely fused around that edge. And we call that now as anatomical maturity, because all structures in the body at that stage have reached maturation. They cannot grow any further than that. So we see that as long as it's still blue and the joint there between the xiphoid process and the body is not completely closed, what we call the xyphosternal joint here. This one is manubriosternal joint. If it's not completely closed, then you can determine the age of that individual as being below 25th year of life, because that ossification occurs around 25th year of life. So you can tell the age of an individual just by assessing the skeleton features, especially those that do forensic anatomy. You can easily identify those and determine or approximate the age of an individual. So that's all about the sternum. Other clinical features are in cases where the sternum failed to fuse. So development of the sternum. If you see here, there's more like a vertical ridge. So the sternum is developing from lateral ends and then fuses in the midline to form one body. Now, what happens is that in certain cases, you find that because of interference with processes of embryology or development of the human body, the sternum fails to fuse and therefore leaves a gap in between. And what will happen now is thoracic contents, for example, the heart, tend to be exposed to the external environment, condition known as ectopia cordis. Ectopia cordis, where the heart is exposed to the external environment because the sternum is underdeveloped or sometimes completely absent. So what we just have is skin covering the part where the sternum is. The bone itself is deficient. Okay. Such conditions are seen in newborn babies who have congenital malformations. Let's look at the ribs. So ribs, we have 12 pairs of ribs, 12 on the left, 12 on the right. So in total, we have 12 ribs. Then spaces between ribs, because ribs are arranged in that vertical manner. So the spaces between the ribs, we call them intercostal space. So this space between rib 1 and rib 2, we call it intercostal space number 1, all the way down. Since we have 12 ribs, meaning we have 12 intercostal space, the 12th rib has no other rib below it. So therefore, the space below rib number 12 is not called intercostal space. Rather, it is called subcostal. Sub meaning below the rib cage. So here is a subcostal space. Then here is the 11 intercostal spaces. Before we go any further looking at the shape of the ribs and the likes, let's look at the orientation of the ribs. So we see that the ribs here are oriented in a slanting fashion. So the posterior attachment on the vertebral column there is superior to the anterior attachment to the sternum. So the level is not at the same plane. If you draw a horizontal line here, cutting there, you see that the attachment to the anterior surface, to the sternum, is below. So the rib cage is slanted or is tilted downwards. So if you see, ribs are running like that. From superior, they're going first of all lateral, then go anterior and inferior to attach to the sternum. So that's how the rib cage is arranged. Okay. Away from that, we can now look at classification of ribs. So we can classify ribs based on two systems. So we have the first system looking at the shape of the ribs. First system focuses on the shape of ribs. So out of that, we have what we call typical ribs and atypical ribs. Typical ribs and atypical ribs, just looking at the shape. Okay, now let's see what typical ribs look like. So number one is that typical ribs are concave. So typical ribs have a concave depression. That's number one. Then a typical rib will have a head, a typical rib will have a neck, a typical rib will have a tubercle. So this is a typical rib. First of all, it has a head here. Then this narrowed part, we call it the neck. Then on the neck, there's a tubercle there. I mentioned, so the tubercle serves as point of attachment to the transverse processes of the intervertebral disc. Then on the head, there are two depressions. You see that one below and another depression above there. We call those as facets. So there's a superior facet and inferior facet found on the head. Then on the neck, we are looking at the tubercle. Apart from that, the typical rib has a body that is curved. So the body makes this curve or arc, if you like. Goes lateral, then finally goes back medial. Apart from that, the body is also twisted. It seems as if it's almost tying on itself. Then apart from that, the undersurface of a typical rib will have a groove, a very shallow groove here, which we call the costal groove. So those are features of a typical rib. First of all, a typical rib has head with two facets, superior and inferior, has a neck and a tubercle. It has a body which is angulated or arced, if you like. It has an arc. And then you have a subcostal groove. Each rib has a costal groove under its surface. And we see that this groove is created by three structures, which we call the neurovascular bundle. Neurovascular bundle, which is intercostal vein, intercostal artery, and intercostal nerve, abbreviated as VAN, V-A-N. Those structures are wrapped in one sheath of connective tissue, and they lie in the undersurface of the rib and create that depression. So which ribs do we consider as being typical? So those are rib 3 up to rib 9. So rib 3 to 9 will be more or less the same in terms of appearance. You may find it difficult to distinguish which one is rib 7, which one is rib 5, which one is rib 4, because they will look more or less the same. And they have all these features present on them. And therefore, we call them as typical ribs. Another feature I want you to focus on is if you observe on its anterior end, this is posterior. This is where it is attached to the vertebral column. Here it is attached to the cartilage. Then the cartilage goes to attach to the sternum. Now see that a typical rib, its costal surface here, the anterior end, its anterior end is blunt like that. We'll find that other ribs, they are going to have different shapes in the anterior end here, but all of them, rib 3 up to rib 9, they have a blunt anterior end for attachment with the costal cartilage. Let's look at typical ribs. So meaning the remainder now are typical ribs, which is rib 1, rib 2, then rib 10, rib 11, and rib 12. Those are considered as atypical ribs, or you can simply say modified ribs. So atypical ribs are modified ribs, or we can simply say special ribs, because they tend to have features that are not consistent with those of typical ribs. So let's look at atypical rib number 1, which is rib 1. So rib 1, why is it modified or considered atypical? Number 1 is that it is the shortest rib in the body. Next, it is the broadest and most curved rib. The shaft is not twisted and it has no costal groove. So this is rib 1. Quite different from what we saw on typical ribs. Yes, it has a head, it has a neck, tubercle there, but look at the shape itself, totally different. A typical rib is thin, like that, but this one is flattened and very broad. If you observe this one, the thickness of the rib is quite thin, but this one is quite broader and flattened, but this one is more elongated vertically like that. So this is a first rib, and we consider it as being atypical. Aside from that, look at the anterior end. The anterior end is not blunt, it is sharpened and roughened like that. In addition, this diagram is not showing us the undersurface of this rib. This rib lacks a costal groove because there are no blood vessels running under it like seen in other ribs. There are no neurovascular bundle. I beg your pardon. The neurovascular bundle creates the costal groove. So we're saying in it, rib 1, there is no costal groove because the neurovascular bundle is not running under the surface of this rib. So it lacks that marking or feature that is seen in typical ribs. Let's look at another rib that is considered as being atypical or modified. It's second rib. So second rib is quite similar to rib 1, except that the length is almost twice the length of rib 2. Okay, let me take you back to the rib cage so that we make something here. So this is rib 1. Here we can see it's quite thick, short, and curved. Even rib 2 is similar in fashion, but this is 3 going down. You see that there's a difference between this one and this one. These two are more or less the same, but these are quite different from those earlier on. So this is another diagram showing us the rib cage. So that is rib 1 there. You see that it's running a shorter distance from the vertebral column to the sternum. That's why it is short. Rib 2 equally, but a bit longer than rib 2. So they are considered as atypical ribs. So what is so special about rib 2? Number one is that its shaft is sharply curved. So it has a sharp curve in the shaft, or what we call the body. Then the body is not twisted like we saw in typical ribs. So in terms of appearance, it's easy to pick out which one is rib 2 and rib 1. They will be looking more or less the same, but the one that is longer is actually rib 2. Let's go to rib 10, because we are now saying from rib 3 up to rib 9, those are typical ribs. Typical ribs, like the way ribs should be. Then these others are modified, or what we can call atypical. And so 10th rib is also atypical. So what is special about it is that it's short. The moment you leave rib 9, you go to 10, you see that the length has reduced, okay, as compared to the other ribs. Okay. So this is rib 10. It's quite shorter than these others. This is rib 9 going up to rib 3. So this is rib 3. This is rib 9. This is 10, 11, and 12. So this is quite shorter than these typical ribs. Even though it's appearing like typical ribs in terms of shape and the rest, you see that it is quite shorter. What else is so special about rib 10 is that rib 10 has a single facet. Remember, on the head, we're saying on the head, for the rib to attach to the vertebral column, it has 2 facets. Each facet is attaching to the vertebral bone. I'll take you back to the diagram that we saw much earlier on. This one here, that's the head. Now on the head, there are those 2 depressions. what we are calling facets. Now, these ones, superior facet, inferior facet. So the superior facet is attaching to this vertebral bone above, whereas the inferior facet will attach to the vertebral bone below. Now, when it comes to rib 10 attaches only to one vertebral bone. It will not attach there to one above, one below. It will just go direct to the body of thoracic vertebrae number 10 and attach there. So it has a single facet instead of having two facets like typical ribs. So again, it can be easy for you to identify which one is rib 10, because in terms of shape, it will be looking like these typical ribs. But if you examine the head, you see that there will be only one single facet. What about 11th rib and 12th rib? So these ribs are quite similar to each other. They are short ribs and they have pointed ends. Remember where I was saying the anterior ends is where the costal cartilage is attached. And for typical ribs, we saw that the anterior end was blunt. But 11th and 12th rib, we see that the anterior ends are pointed. Next is that these two ribs lack the neck and tubercle. So they are neckless and tuberculous. They don't have those features. So if you're examining them, you won't find those features on them. Then it will be easier to know which one is rib 12 from rib 11, because rib 12 makes no angle. Okay. 11th rib, yes, it have an angle. Rib 11 will have a costal groove like typical ones, but rib 12 has no costal groove and it doesn't make an arc. So it doesn't make an angle. It is more pointed to the lateral side of the body. Okay, let me take you back to the skeleton here. You see that is this 11, this is 12. So 12 points lateral ways. It doesn't make an angle. 11, the angle is slight there because it tends to curve inwards. But 12 points outward. Then see that their anterior ends are pointed. You see that they're very sharp and pointed forwards. So this is consistent in both male and female skeleton. So that is how we can classify ribs based on shapes or features, if you like. Let's classify ribs based on attachment now. So based on attachment, we can classify ribs as false ribs or true ribs. So the next classification or system of classifying ribs is based on attachment. So a rib will be attached to the vertebral column at the back or posteriorly and attached to the sternum anteriorly. So we see that from rib 1, this is rib 1, this is rib 2, 3, 4, 5, 6, 7. These ribs are attached direct to the sternum. So we call those as true ribs. So rib 1 up to rib 7 here, these are true ribs. Rib 8, rib 9, rib 10, 11, and 12 are considered as false ribs because, yes, they are not attaching to the sternum directly on their own. If you observe, this is 8, this is 9, this is 10. They have costal cartilage there, and their cartilages are joining with each other. You see that this is 10 attached to 9, 9 attached to 8, 8 is attached to 7 to reach the sternum. So we don't consider these as true ribs. So 9, 8, 9, 10, 11, 12, all of them are false ribs. Then among false ribs, we have what we call floating ribs. So rib 12 and rib 11, we call them floating. They belong to false ribs. Then among false ribs, we have what we call floating ones. So that is 11 and 12. They have no attachment to the other ribs above them. So that is rib 10 is attached to 9 above using a cartilage. Rib 9 is attached to 8 above it using a cartilage there. So these are quite different from 11 and 12 because they are sharing this attachment, but 11 and 12 doesn't have that characteristic. So that's how we can classify ribs based on attachment. We have false and true ribs. Okay. So true ribs 1 to 7, false ribs 8 to 9, floating ribs 11 and 12. Okay. So now let's look at the intercostal space. Look at intercostal space. So intercostal space, like we are saying, this is space between ribs. And we said there are 11 intercostal spaces. The last one is called subcostal, the space below rib number 12. So within the intercostal space, we are going to find various soft tissue structures. So what we find there are muscles and nerves. Of course, there is connective tissue, but we don't consider it much. So first of all, there is skin with its subcutaneous tissue. When that is exposed, then we can see muscles. So we have 3 types of muscles occupying the space between ribs. So there's a superior rib there and inferior rib. So this can be rib 1, this can be rib 2, or this can be rib 6, this can be rib 7. However, the structures are the same. So what are we looking for in intercostal space? So first of all, we have external intercostal muscle. Then we have internal intercostal muscle. Then we have innermost intercostal muscle. So 3 layers of muscles. External intercostal muscle, internal intercostal muscle, and innermost intercostal muscle. In addition to that, we have neurovascular bundle found in between the ribs or in the intercostal space. Neurovascular bundle, neuro, nerve, vascular, these 2 vessels, then as a single bundle. So this is called the neurovascular bundle. And the arrangement is consistent. The vein is always superior, in the middle is artery, then inferior is the nerve. So that is intercostal vein, intercostal artery, intercostal nerve, simply abbreviated as VAN. Okay. So let's look at intercostal muscles. We begin with the external one. So external intercostal muscle. How are the muscle fibers oriented? So here we can see clearly, this is external intercostal muscle. So these muscles have origin and attachment. Like any other muscle in the body, it has to have where it is originating from and where it is attaching to. So all skeletal muscles have this description. They have an origin and attachment. And in terms of pulling or contraction, these muscles, the skeletal muscle, pull towards the origin. So when the muscle fibers are contracting, they are pulling the attachment towards the origin, which would determine in few minutes to come. So in external intercostal muscles originate from a rib above on its outer surface, and then descend downwards and move medially towards the midline here. So the muscle will be beginning from the posterior end there on the superior rib, then descend towards the inferior rib and move towards the medial side or towards the sternum here. So that is their orientation. Orientation is superior, inferior, and posterior, anterior. That's how the fibers are moving. They are moving from the superior end to the inferior end, then from the posterior end to the anterior end. Superior, inferior, posterior, anterior. So if this muscle contracts, it will pull the rib below here towards the rib above. And since they are moving posterior to anterior and lateral to medial, I forgot that one, lateral to medial. the external intercostal muscles move superior, inferior to touch to the inferior rib there, and then move from posterior to anterior and lateral to medial. So when the rib, when this muscle contracts, it pulls the rib below, above, and then moves the thoracic cage laterally. So that's what will happen when this muscle contracts. The rib cage will expand. So external intercostal muscles are muscles of inspiration. When you're breathing in, the rib cage should expand. And these muscles together with the diaphragm help to do that. Let's look at internal intercostal muscle. So internal intercostal muscle, the orientation of the muscle fiber is opposite to external. So of course they are moving from the superior rib to the inferior rib, that is correct. But instead of moving from posterior to anterior, these fibers move in a direction that is anterior towards posterior, and from medial to lateral. So when these muscles contract, they will pull the rib cage inwards. So internal intercostal muscle is muscle of expiration. When you're breathing out, the chest wall should shrink so that pressure inside the lungs increases and air is forced out of the lungs. So these two muscles, external and the internal intercostal muscles, occupy only this space here, the intercostal space. Now we look at innermost intercostal muscle. Innermost intercostal muscle will cover at most two intercostal spaces. So it will run from this space, cover that space, and also that space. 3 or 1.5 intercostal spaces, unlike the other two that we have discussed already. So in terms of direction of the fibers, innermost intercostal muscle is same as internal intercostal muscle. The fibers are moving from the rib above to the rib below, but moving from anterior towards posterior or medial towards lateral. So they are also muscles of expiration. Oh, I'm coming. Let me just finish my class.
Sorry, can you wait from outside?
The teller.
From there, you can sit there.
You can come in. Better come in. Okay. Okay, it's fine. Okay, you yes. All right. Okay. So that was about innermost intercostal muscle. Innermost intercostal muscle acting together with internal intercostal muscles to shrink the rib cage so that there's pressure in the lungs and then air is forced out of the lungs. So it is a muscle of expiration. So those are the muscles found there. Okay. Next, we are going to look at the neurovascular bundle now. Okay, so this is our next focus, is the neurovascular bundle. We'll look at them one by one. We'll look at the nerve, we'll look at the veins and the artery.